Professor Vivienne Nathanson is from the British Medical Association. Good evening to you, Professor. Your reaction to this case and the judgment today?
It's a very important judgment and we'll be looking at it in great detail. In the majority of the judgment, what it's saying is that the best practice guidelines that the BMA and the Royal College of Nurses and the Resuscitation Council have put out are fine. What we do need to do, however, is to make sure that everybody is aware of them and follows them and really understands the way in which you need to assess whether it's appropriate to, on the very rare cases, not talk to a patient.
What does it mean then for doctors going forward? Will most of them carry on as they were, or will they have to change their behaviour?
Well, we think that in the majority of cases, as far as we know, doctors are following the guidance, which is to talk to the patient, to tell the patient. And in those cases where the patient cannot make decisions for themselves, then to talk to the nearest and dearest, the next of kin. But obviously, this is a reminder to anyone who is ignorant of those guidelines that they need to actually follow them very closely.
But also a reminder that mistakes can be made, and families of people in a similar situation to that lady will be scrabbling around now to look for those horrible letters DNR.
Well, it's not DNR, it's DNA CPR.
DNA.
And that's
Okay.
actually quite important because one of the things behind this is that some people think that every time you attempt a resuscitation, it's going to be successful. In fact, the evidence is that however hard you try, in most cases, it won't be. So it's extraordinarily important, and that's one of the discussions that doctors and nurses and others have with the patient and with their family to make them understand that this isn't about denying something which is going to return them to health. This is actually very often about not putting them through, in those last minutes of life, something which will have no opportunity to improve them, to save their lives.
But even if the patient is not in a place to be told, it should always be discussed with the family?
It should always be discussed with the patient if the patient is capable of taking part in the discussion, other than, and the judge has made this quite clear, where it would be harmful to the patient. However, if the patient can't take part in that discussion, that's when you go to the family and talk it through with them.